Hello and everyone, and welcome to NAPCAN's National Child Protection Week webinar series. Today's webinar, what you can do together, you can never do alone. Organisations working together for children and families. My name is Lisa Waters and I'm the Deputy CEO at NAPCAN. Excuse me. I'd like to start by acknowledging and paying my respects to the traditional custodians of the beautiful land where I am today. I'm on Anaiwan country, but I'd also like to acknowledge the fellow nations of the Gumbangir, Kilmillaroo and Dungari, and pay my respects to their elders past, present and emerging. I would like to acknowledge all of the elders past, present and emerging from the lands that you might be watching from today, and welcome all Aboriginal and Torres Strait Islander people who are logged on. It might be nice to put in the chat function where you're coming to from today. You won't be able to see that, but I will, and get a bit of a sense where people are logging on from. It's also really important to acknowledge children in these communities because that's where culture will live on. NAPCAN is very fortunate to work across this beautiful nation, and as part of that, we're always very mindful of the devastating impacts of colonisation on Aboriginal and Torres Strait Islander peoples and communities. So now, a little bit of important housekeeping. If you're not familiar with GoToWebinars, I'd say you've had a very different life to me in the last 2 years, but the control panel is on the right-hand side of the screen. If you do run into some technical issues, please ring our team or email them. The contact details will be down the bottom in the chat question function for you. You are in listen-only mode, so you can't turn your camera on, you can't turn your microphone on, so just relax and listen. In the control panel towards the bottom, you'll see a chat function and it'll have some links about some of the content that we're talking about today. Then the question chat function will be enabled for questions. We have we've got about 200 people online so far today, and I'd love to get questions from the audience for any of our panelists. So can you keep those questions coming through? It's nice, I can see we've got people from Walgett, New South Wales, Queensland. Yeah, we've got people from the Northern Territory. There's people logging on from everywhere. Thank you for sharing that with us. The webinars will be recorded and posted on our website in due course when we sort of catch up. We've got a big series this week, so there's still time to register for some of those. This year's National Child Protection Week theme states that every child in every community needs a fair go. The theme speaks for itself. If you want to find out more about the theme, though, you can go to the link in the chat box. This year, the conversations that we have are in the shade of this ongoing COVID-19 pandemic. The impacts of this will be seen for years to come. So today we need to just acknowledge that there is a much greater need for us to come together as a community and support children, young people and their families in any way that we can. We need to band together and emerge from these challenges in a way that allows us to centre on the well-being and safety of our children and young people more than ever before. So today we're going to be talking about how we can all work together towards a community where children thrive and their families are supported. So it's my pleasure to introduce Dr. Cozzy Croscombe. I have been fortunate enough, I know Cozzy from high school days. We grew up in a regional community in New South Wales. So I've been fortunate enough to follow his amazing career and have seen that he is truly gifted at engaging communities. Cozzy's primary work has been around collaborative approaches to solving complex systemic issues in marginalised communities. He's predominantly done this from a faith-based approach internationally and now back in Australia. I could listen to Cozzy for hours, and I have to say he wasn't excited to be doing this webinar because he likes to have an audience there to get feedback from, but it's a warm welcome to Cozzy. I'm going to hand over to him and he's going to talk to you. Okay, thanks Cozzy.
Hey, thanks Lisa. Hey, thank you everybody. I'm really humbled to be here. I really appreciate the work that NAPCAN's doing, and obviously those who are tuning in are also involved in the field, which is yeah, such a challenging and complex field, and I'm sure all of you have many things that you could share and many ideas around this. So I feel very humbled in being able to share today. I'm coming from Emerton, which is kind of part of Mount Druitt, Western Sydney. I've only been back here for about 8 months. I spent the past 28 years working in Philadelphia in what we describe as a poor urban community. I'm going to use the term marginalized here. I know that has different meanings to different people. Kind of use the terminology to mean that people are being pushed to the margins by the system. So more so about what the system has done rather than what's going on for the individual. Born in Newcastle, mostly raised in Armidale. Ended up with being in a broken family, moving around quite a lot, and ended up in housing commission for the last part of my high school. University dropout, went back into education quite late. So I was about 35 when I went and started studying again and moved on from there. I was mentioning that the last part of my life has been in Philadelphia, and mostly working in Philadelphia is the poorest city in the United States of any of the major cities, and we worked in the poorest part of there, and also lived in that community, raised my kids there. And what we found was that we live in these really complex organic systems. The systems are not easy, but they're interconnected. And over time, we found that the majority of organizations, whether it's government or private organizations or individuals, try and solve the problems with a individualized approach. They look at one element of a system and try and fix that element of the system. And we found over time that actually often made the system even worse, made the problems worse. Example for me where it became really real was my daughter, eldest daughter, needed a bone marrow transplant a few years ago. And so we were in the children's hospital with her for about a month as she got this intense chemo. And I'm sure some of you have probably been through similar experiences or those close to you. I was amazed at the idea they had to basically poison her to kill off one part of her body to keep the rest of it alive. But in doing so, her whole body was affected. And we'd see all these kids come in who looked fairly healthy when they came in. And then, a month later, they looked terrible as their hair fell out and they became thin, throwing up all the time. And what we learned was that you can't separate out parts of the system. You couldn't just pull her bone marrow out and then put it back in again in a healthy way. And so that's the kind of systems we're in. We're in these really complicated organic systems. And so a little bit today, talk about those systems and then what the challenges are for us to be able to work together in those. I remember one day my young daughter came home from school and she said she was really having a hard time at school because the boys at her table annoyed her. And I was like, well, why don't you just change tables? And she goes, no, Dad, my teacher sits me there because I have a positive influence on them. So I began to do a chart one day and I wanted to figure out all the things that went into my daughter's education. And I started with, it was the teacher and the other kids in the classroom and the funding that they got in the school and the transport they got. But as I got deeper and deeper, I found that there were so many levels of complexity. It included the education of the teacher. It included the government strategies. It included everything that was going on in every other kid's life sitting at the same table. And so we couldn't solve her problem and we couldn't solve the education problem just looking at one aspect. We had to look at the whole system. And this is what's led us to think about this idea of collaborative-based approaches. Well, what we really look at is that organizations shouldn't see themselves as competitors. They should see themselves as strategic allies within the system because we need everybody working together to solve the complex issues. In our cases, we often use this terminology, a theology of abundance rather than a theology of scarcity. You're not my enemy, you're not my competitor. In the cases what we're talking about today and for this week, the enemy is abuse. And so I'm not concerned that another agency is taking something away that I want. I'm concerned about how we work together to solve complex issues. Example we found, so we're working in an extremely poor community. The majority of people in our community were living well below the poverty line. Very complex dynamics. And one of the main programs I was involved with was a health center. So we started a health center in the community, grew to multi-site location, servicing the poorest people in the country. What we find is that a doctor would see a patient, and often the real issue that the patient has may not be something that a primary care doctor could solve. And so we found that often a doctor was restricted in what they could do, and they needed allies. So we formed partnerships of about 12 organizations in the same community, mostly faith-based organizations for our context, and found ways they could work together. And so an example would be that somebody would come in to see a doctor, and through the conversation, the doctor would realize that a lot of the underlying problems were caused by the stress this person was going through, and perhaps their stress was caused by an ongoing legal issue. Well, we'd created a free legal service, and so the doctor would refer the patient to the legal service. The legal service would look at their issues and begin to strategize around how to change their legal predicament. But at some point, they came across and realized one of the issues was transportation for this person. They couldn't get down to the courthouse to clear things up. So they'd send them across the street to the bike shop, where we had an earn a bike program. You could work in the shop and get a free bike. So they would go into there, and then now they would have a bike. And so we'd be looking at those three dynamics. And then somebody in the bike shop would realize, hey, this person has a challenge. Their kids are not getting a proper education. And so they'd refer them across the other side of the street to an educational place where they could get tutoring, or in some cases, technical assistance for their school. And so we found that they worked together to solve the complex issue that the person had. The issue wasn't just a medical issue, nor was it just a legal issue, nor was it just an educational issue. It was complex. And so they could work together to help solve that problem. Now, we also found that it wasn't such a flashy thing. You know, a lot of times funding wants to come in and give you money to solve one big issue because it looks good. And we found that in fact, we needed to work in smaller scale, in a more holistic or a more diverse way of solving those issues. Another example we found that maybe relates more here is in Philadelphia, the Child Protection Services is run by the city, and it's called DHS, Department of Human Services. And we'd say in Philly, you can make any threat you like against people and get away with it. The one threat you could never make was, I'll call DHS on you. I mean, I could threaten to shoot you and it would be okay, but don't ever threaten to call DHS. And because it had such a horrible reputation through the communities, the idea of stealing children. As we got to know those in the system more and develop friendships with some of those working in the system, we found that DHS actually had some really great strategies and had really positive benefits, but they had no connection into the community. And so people wouldn't use the positive services, the services that would be preventative. And so it ended up that DHS was mostly doing removing of kids rather than the prevention. So we formed some collaboratives as they moved their services from a centralized location back into the communities with agencies, and then we formed partnerships with the faith community. Now, this isn't the case everywhere, that faith communities have a positive recognition, but we found generally in poor communities around the world that faith communities are a trusted place. So instead of somebody having to come into a service in a corporate office, they maybe come to a church that they knew or trusted, or another place in the local area. That was a huge deal. And so what we could do then is help the community bridge the gap to the services. We could find that the kids in care for our community could stay in our community rather than being moved out to other communities. We found that the agencies could then learn how to work both with the city and with the faith-based organizations. We found that there were issues that we obviously couldn't solve at the local. There were funding strategies. I'm not sure how relevant it is here, but we found that most of the US, you're not incentivized to do prevention work. You're incentivized to keep kids in foster care. The agencies were paid based upon how many kids are in foster care. So that had to change. And so we couldn't do that locally, but certainly the larger agencies and the city-based things could. And so that was part of a negotiation with the state and the federal government to get the entire funding model changed so that more money would go to prevention, to helping us create healthy families rather than just putting kids into other homes. And so there's some of the things we found in our context and communities when we had people working together. Again, in our cases, we found that the faith base was essential to this. And if you've never been around a church or haven't been in that context, it may surprise you, but Christians, as well as the other faith groups, are mandated to take care of children. It's one of the strongest things that you find in the Bible is the idea of taking care of children. And I think sometimes we haven't done a great job of that. In other cases, I think that the church does a really good job. And I think in a lot of agencies, there's a lot of Christians working, as well as those of other faiths, who are motivated by their faith to do the things that they do. I think sometimes there's the impression that every Christian just wants to convert you to their way of thinking. And sometimes that can feel the case. I don't want to downplay that it's my faith that drives me, and I want you to know that I believe there's a God who deeply loves you and is passionately interested in you and being involved in your life. But whether you think that's true or whether you think I'm completely delusional from my thought, it doesn't change the fact that I want to be engaged in helping transform a system. And so I think that's one of the challenges that we face sometimes when there's faith-based and non-faith-based is how do we communicate that we're in the same space because we have many of the same goals. And that's, in this case, taking care of kids. It's a primary goal. My wife and I did quite a lot of foster care. As I mentioned, my eldest daughter's adopted. Another story for another time. She has a fascinating story. But we found that just being in the community compelled us to be involved in that we couldn't say that we really cared about our community and loved our community if we weren't involved in the welfare of the children in our area. I'd also say that in the cases we've seen and the areas I've worked in, I think the same for the Mount Druitt and the Western Sydney areas, is we see amazing strengths in the communities. I actually think that the truest change comes from the margins. It doesn't come from the center points of power. They need to be involved because they control certain things, but the real change comes from the margins. My wife's a school teacher, and one of the lessons she told me early on, now she worked in the poorest communities in Philadelphia and extremely under-resourced schools. She told me that she couldn't work with kids without working with their families. That the family was essential. And she'd often remind me that as much as we love kids when they came to our program or they turned up at the school, at the end of the day, they were still going back into their homes. Somebody else was generally providing the food and shelter. It wasn't the school teacher and it wasn't the school, nor was it us as a church. And she really got me thinking this idea that the family becomes such a critical asset in how we look at the kids. And from building from there in the complexities, I realized if we wanted to see healthy children, protected children, we also needed to see healthy families. And to get healthy families, we needed all these other parts involved. So the parents became invaluable assets, but so did the school teachers and the social workers and the police officers and the justice system and the store owners and the executives and the lawyers and the politicians and the posties. Everybody who's part of a community became part of the assets that were needed because it's a complex organic system. We can't just separate the pieces out. And this is what I guess my encouragement today is, as you think about things, is not to separate the pieces out and not to think, well, our job is just to do this one role. Our job is just to provide this one element of service. Because as a single element, it tends not to solve any of the complex problems. There's a piece in the Bible, one of my favorite pieces, often used in weddings, but it's a much deeper piece. And it goes, two are better than one because they have a good return for their work. If one falls down, the other will pick them up. Woe to him who is alone when he falls and has not another to lift him up. Again, if two lie together, they keep warm, but how can one keep warm alone? And though one can be overpowered, two can protect themselves. And that becomes a basis of how we talk about this thing. Just we work better when we work together. When we just see each other as competitors and effectively as enemies, it tends to be more problematic, and we tend not to solve any of the complex systems. One quick story, and then hand back over to Lisa, is there's a research issue that's called the Boston Miracle. And the Boston Miracle is just over a year that went by in the city of Boston without a single youth homicide. Now, in Australian context, that may not sound as great a thing because the homicide rates are low, but to give an idea, in Philadelphia, there's over 400 homicides a year. Most of those are young men killed in just a few specific communities. So to go a year without a youth homicide was considered miraculous, and all kinds of groups stepped forward and said why they thought they were part of the solution and how they thought they solved this problem. And a guy called Kari Bridgewater, working out of Emmanuel Gospel Center, working with a team from MIT, charted it out. And what they found was that there was no single solution. There was no single thing that anybody could point to about how this was solved. They found that it included people who were working to prevent kids getting in gangs, people who were working to get kids out of gangs, people who were working in the juvenile justice system. It included judges who changed their sentencing patterns. It included parole officers. What was probably the most amazing, though, was that it came from the street. It came from those on the street who said, enough's enough. We want to see the system change. And it moved up. Now, they took the framework of this and tried to implement it in Philadelphia, and it completely failed. And one of the reasons it failed because it was a top-down implementation. It wasn't those who own the community rising up, but it was those from above who were projecting down. And so that again taught us that the collaboration, the approach had to come, but had to also come from the street level. And we say this because in our communities, those who are most affected by issues around abuse are those in our communities. And so we're the ones who need to be the most motivated to see this change happen.
Thank you, Cozzy. I think I could listen to Cozzy talk all day. He's got so many good stories, and I think often how we get our message across is through this storytelling. But one of the things that you talked about, Cozzy, is that you said that changes come from the margins, and I want to know how you actually do that, though. Like, maybe you could share the example that you gave about the spider webs versus the spoke, because I think that's another really good analogy that we could share with the listeners.
Sure. Yeah. So it begins with what we call assets-based development, right, rather than deficits. So I'm really good at deficits. I get brought in a lot to talk about what we do wrong and why systems aren't working. And if you ask my family, I can be really horrible to live with because I'm always walking around telling everybody what they do wrong. But really, people don't grow very well when you keep telling them what they do wrong. And we've found in particularly in marginalized communities, people already know. They know their issues, right? You don't have to go up and mention to somebody that you've got a problem. They know they've got a problem. What we found is assets-based. Let's build on the assets. And like our family has chosen to live in poor communities because we think they're better communities. And this can sound crazy to some people, but there's this deep level of grace that exists amongst poor communities. There's an acceptance. I've never been rejected from a poor community. I've been rejected plenty of times from wealthier communities, but I've never been rejected in a poor community. And so we moved into Mount Druitt and been accepted, right? We're middle-class people who've moved into a poor community and been accepted. If it's the other way around, it doesn't happen. So there's this beautiful picture of grace. There's a beautiful picture of community. You know, right? It's a tragedy that COVID spreads. It's a tragedy, like in our community, it's spread. There's over 800 cases through the Mount Druitt area right now. But part of that is because people still get together, right? People still want to be in community. They don't want to be isolated in their homes, right? There's a really beautiful picture in the midst of a challenge. And so I think that's one major thing is we've got to look for the assets in the communities and the assets that people have. And often those assets are not formalized education and they're not money. But just because someone hasn't got a formalized education doesn't mean they're not educated. You know, in Philly, we found some of the best, if not the best entrepreneurs were mostly involved in illegal activity, right? For us, mostly around the drug trade. They were highly skilled men and women who had phenomenal entrepreneurial skills. We just needed to figure out how to get them from a pretty horrific illegal trade into something really positive. But we don't want to begin by saying you're an evil, horrible person, right? We want to say that, wow, you've got an amazing skill set. How do we use that for the benefit of our community? One of the things we do talk about is how to build the collaborations. And we found that most groups who collaborate use a hub and spoke model. So they have some center point and they try and get everybody to join them. And they spend all their energy getting everybody to join their agenda. And then once you've got that, no one has any energy to do much else. We've taken what we call a spider's webs approach, where I want to connect you, not with me, but with somebody else who's doing similar things to you. And I talk about this in my own life is, you know, I'm the person that I've got two friends and I introduce them and they become better friends with each other and off they go. And, you know, they're out at the pitches and having a good time and I'm stuck at home by myself. But they've formed a relationship that's strategic and helps them move forward. And that's what we're looking for is in the communities, in the context, you find others that have a like mind, a like goal as you do, and you begin working with them. But they don't have to join you. They don't have to become part of your organization or part of your goal, because people are more passionate when they own their own piece. You know, it's one we say in communities. Like, for instance, we've got a graffiti issue here, and one of the ways we found to solve graffiti issues is to get the graffiti artists to do the murals for us. It solves their issue. In Philadelphia, there's over 1,000 murals that have been done by graffiti artists that are up, because they own it, right? And they're not going to tag on it.
Yeah, exactly. I'm just seeing some of the questions that are coming and going, what's the name of your service in Mount Druitt and how can I connect with you? We will put some of those details in. Yeah, and he's got a lot of stories, but I think you've nearly run out of time, but we'll come back to you at the end, I hope, Cosy, and then we can talk about how we do start with where we start in the system. Like, if you said you can't separate the parts, but we have to start somewhere. So I'll leave you with that thought, and maybe we can come back to that after the other speakers. So
Thanks.
Speak to you. Thanks, Cosy. Thanks, Cosy. I'd like to introduce Marin Looney. She's NAPCAN's Northern Territory Manager. She's a qualified social worker and has worked with children and young people and their families for 30 years in various capacities. I've been fortunate enough to work alongside Marin in the Northern Territory and have learned a lot about community engagement and recognising the power of meaningful listening, which is also what Cosy was just talking about. So welcome, Marin.
Thanks, Lisa.
Marin, you and I have talked recently about the Productivity Commission report in the Northern Territory, and it outlined barriers that have hindered people's ability to work together in partnership, including short funding cycles and competing priorities. But one of the things that you've been able to do is bring organisations together, and it flows on really nicely from Cosy's introduction, and people have worked really well together. And a great example of that is the Safer Communities for Children project that you've helped develop in the NT. Can you talk to the listeners a little bit about the process and how it was developed?
Sure, thanks, Lisa. Firstly, I'd just like to acknowledge that I'm joining you from beautiful Larrakia country in Darwin. So this program, the Safer Communities for Children program, actually started with organisations telling us that there was a gap. There was a need for a primary prevention program for young children that focused on protective behaviours and respectful relationships, but not on expecting children to have to recognise if someone wanted to harm them. They were also after a community approach that emphasised the role of adults in keeping kids safe and that would engage children's voices. And I'd really love to talk more about the actual program now, but my colleague Sammy will be doing this in the Queensland webinar tomorrow. So hopefully you can tune in and hear more about it there tomorrow. So I shared this message about what the gap and the need was at a Palmerston Indigenous Network meeting a couple of years ago, which is a bit unlike other sort of network meetings where organisations just share, you know, what they're up to. This particular network has a real solution focus, and it aims to help organisations access the supports and resources that they need to support their work with families. So the people at the meeting were really supportive of this as a project and helped me sort of identify a funding round with the Northern Territory Primary Health Network. So we applied for funding and we were successful, and so that actual meeting was really the start of the process of gaining community support for the program. So then we started talking about the project with stakeholders, and we did this even while we were waiting to see if our submission was successful, because we were so excited about the possibilities. And it really reinforced to us how keen people were for this type of program. They were actually excited and waiting for it. So right from the start, we knew that we didn't have all the knowledge and the expertise that we needed to develop a program like this. So we held a consultation with representatives from quite a broad range of sectors like early childhood, family support, disability, migrant and refugee groups, Aboriginal controlled organisations, and departments such as health, education and child protection. So together we looked at themes, the goals and the considerations that needed to be covered in the program so that we could make it relevant, it could be inclusive and engaging and effective for children and communities.
So tell me, Marin, like how easy was it really to get organisations involved in that process though? Because it sounds like it would be really tricky.
Well, we actually thought it would be really tricky and we were so surprised and thrilled about how easy it was. So the program is actually based on bush animal stories and we actually needed to write these animal stories. So we approached a number of organisations and we explained the program and what the goals were, and we asked if they had anyone they thought might be interested in helping us to write some stories. And we were really amazed at how supportive people and organisations were. We ended up running a 4-day story writing workshop in Darwin, and we had people from Alice Springs, Tennant Creek, Katherine and Darwin attend for 4 days. And organisations actually provided this as in-kind support for the program's development. And there were 10 of us all together, and we know how tight funds are and how stretched organisations are with staff. But I think we managed to get this support because the organisations we approached felt that they could really add value to the outcome, that their contribution would be real and it would be valued. And I think they also could see that the program was going to fill a gap that would really benefit the children and families and communities they work with. And they could also see that being involved could actually benefit their staff and their organisation. And we hadn't really thought about this at the time, but one organisation, an Aboriginal women's shelter, said, oh yes, we're in there, we'd love our children's worker to be involved. We see this as a real opportunity for her to gain some knowledge and skills that will really help her in her work as well. And one person who took part in the training said that he was on a constant learning, or wasn't training, it was the workshop to develop the stories. He was on a constant learning curve that helped him discover skills he didn't even know he had. So we then developed a draft of the program and the resources, and we actually have stunning graphics and artwork done by the wonderful Nadia. And we trialled these through facilitator training in Alice Springs, Tennant Creek, Katherine and Darwin. And some of the participants who'd been involved in the consultations and story writing actually attended the training. And we also supported a trial of the program to be run with children in Alice Springs. So we were, throughout this whole process, and this took, a couple of months and COVID was starting to get in the way, but we were constantly seeking feedback on how we could improve the program, how we could improve the resources and the workshops. And one of the ways that people said they really wanted the program to be improved was to develop a set of feelings cards using the characters in the stories. And I just want to share a couple of those with you. So this is some of the stunning artwork that is based on the bush animal stories. And this really adds value. We wouldn't have even thought of that unless people in the training were saying this would really enhance the program.
So I guess you're saying it was really informed by broad community engagement, a little bit like what Cossy's saying. It was the bottom rising up, and the voices of community were really heard. I just noticed it's in the question function, someone's asked what the program was actually called. We'll put the name in the chat function for you. It's Safer Communities for Children, and you can go onto the NAPCAN website and you can have a look at that. I just want to know though, Marin, how has it been received in the Northern Territory, the program?
Well, we launched it in the NT. I mean, it's a program, it was developed in the Northern Territory, but it's actually relevant to communities and organisations around Australia. But we launched it in the NT earlier this year, and we've started running some of the facilitator training, and everybody really loves it. As we talk people through the training, through the program, they are really blown away by how deep the program is and how rich the program is. I mean, we've got a section on deep listening. That was one of the things that was identified at the original consultation. We really wanted to support workers to listen deeply to children and children to listen deeply to themselves and their bodies and their feelings. And so there's a real emphasis on that in the program. And we certainly couldn't have achieved that and a whole lot of other areas that make it really rich and meaningful if we hadn't had the involvement of so many people and so many organisations from different sectors.
And I think that one of the things in the Northern Territory, the word gets out, doesn't it? That a lot of people come together to develop this project. So as Marin said earlier in when she started speaking, we're going to be talking a bit more about that program in detail. One of our colleagues, Sammy Bruder, who's the Queensland manager, helped develop that program and write that program with Marin. She'll be talking about that tomorrow in her webinar, so you can log on for that. Now, Marin, as I said when I introduced you, you really, I guess I've been out into a remote community with you recently at Nooka, and really was in awe about the way that you brought the community on a journey to develop a commitment statement. Could you just tell us a little bit about that process and why you think it was really successful?
Okay, so what we were doing out in Nooka was we have a 2.5-day workshop that we run out in Nooka, which is for remote communities, which is around providing some resources and some knowledge around protecting children, making communities strong and understanding how we can do that. So we provide all this, but it's actually, the first couple of days are really a journey of us sharing information. But we don't live on Nooka. We don't know, we always, before we go out to a community, we're contacting that community to go, what are the issues? What are some of the things we might need to talk about and be aware of? But the 2-day workshop we do, it's also around helping whoever's in that workshop. And in this instance, it was the Yugulmungi Development Aboriginal Corporation and the board. And to see what do they want to take out of all this information and all these things that we're sharing. And for them, it was to develop a commitment statement to protecting children and valuing children in Nooka. So we spent that last half a day, really, we've sort of got a fairly mainstream one, and we spent the time going through that to go, well, if this is something you'd like to develop for Nooka, how do we make it really meaningful? So it was a process of really looking at, drawing out what are the things that are important to them, what are the things that will be meaningful for their community. And, it took us a few hours and we ended up with an amazing commitment statement that they presented to the rest of the board the next day. And someone the next day hadn't been able to attend that week, so they went, well, I need to join, we need to include this bit. So what this commitment statement now is a document that can give them an aspirational way of working with children and families in Nooka, but also for organisations that are coming in who want to work with children and families in Nooka, they're actually going to go through this commitment statement with them and saying, well, if you want to work with children and families here, you need to sign this and show that you're committed to these values that we want with children and families. And they've now, I found out this morning actually that they've translated that into Creole, and the aim is to also have some artwork, and then it will become a document that will become part of what they do and a part of using that as the board. So I think it was really around listening. So we run that very similar workshop in other communities, and each community comes up with what is it that we want. So for example, in Galawinku, they came up on that last day was, well, we want to have a steering committee to do a whole lot of actions, and they identified the actions that they want. So if we listen really deeply, we go in and we've got lots of stuff to share, but we don't have a footprint in community. So what we want to do is share what we know and what we have, and then support them to use that in a way that's meaningful for their community.
So it was a great outcome, wasn't it? And it was really lovely being involved in that process. But what I'm hearing from you and from Cozzy is that one size certainly doesn't fit all in true community engagement, and that you have to localise it. And we often say when we go out into community, you've got to have plan A, B, C, D, down to Z, because you've got to be flexible in the way that you work with communities. People are asking, can we get a copy of that commitment statement? And we thought people might want a copy of that. It's not finalised yet, is that right?
Yeah, so when I spoke to Yugamungi this morning, they said that once the artwork's done and they're really happy with the finished product, they'd be very happy to share that then, but it's still in draft form and they're not really feeling comfortable about sharing it at this stage. But it is pretty amazing, like the things that they've come up with, and it's we're actually thinking of changing some of the commitment statements that we've developed to be in that more user-friendly, meaningful sort of language rather than, you know, a bit theoretical and high up. So yeah.
And it was really that reframing of language, wasn't it? And one of the things when I was first talking to Cozzy about positive reframing, the positive way that he talks about his community, or and the positive way that we frame questions. So language really does matter. I wanted to ask you about Palmerston, but I won't do that now because I just note that we're running out of time. But do keep the questions coming through, and hopefully maybe park that thought, Marin, and we might get back to that. But thank you for sharing your insights and learnings with us, and we'll hear from you again after we've spoken to Marley. Thanks, Marin.
Thanks.
So I'd now like to introduce Marley Wells. Marley manages the family and community engagement for Connected Beginnings in Alice Springs, and is part of the Child Friendly Alice initiative. The initiative aims to help organisations to work together so that every child can get the best possible start in life and grow up happy, healthy and strong. You might have seen Marley in one of our recent webinars with an example of how true community engagement doesn't actually have to be overly complicated. I'll introduce Marley and she'll come on and say a quick hello and introduce the Child Friendly Alice, and then we'll play a video before Marley and I come back on and talk. So welcome, Marley.
Thank you, Lisa. So what we know is that children and families are more likely to thrive if they're accessing the services that they need and they're given the support that's appropriate for their circumstances. So a big part of my work is the Child Friendly Alice initiative. So what I will do now is get the video played so that you can see. It's just a brief explanation of Child Friendly Alice. The footage is taken from a family and community sort of engagement summit that we had earlier this year, and then I will be back to speak after the video. Child Friendly Alice is the idea that if everyone works together for children and their families, every child in Alice Springs will have the best possible start in life to grow up healthy, happy and strong. It's about working together and sharing the same goals. Currently there are around 40 organisations involved, all of them with a focus on childhood wellbeing. Organisations in Alice Springs work hard to deliver their programs and help the individual families and people they work with, but we need to work together to make sure links between our work is shown and any gaps are filled. We know there is no point doing this work alone, and we know that Child Friendly Alice is missing Aboriginal voice. We cannot make plans for the programs we deliver and for the future without including the people the programs are being made for.
Hey, Marley, could you just tell us a little bit about the work that you do and how the Child Safety Summit came to be about in Alice Springs?
Yeah, absolutely. So with Child Friendly Alice, because it's a connection of people working together, we do have a governance structure that includes a backbone, an advisory group and various different working groups. And so what we really realised through all of those different groups is that Aboriginal voice was missing from Child Friendly Alice and therefore the services that are involved. So what we did with the summit was that it just was really timely. We realised that there was an opportunity to gather Aboriginal voice. We realised that we could get all different clients, families and services to come together in a neutral place. We held it at the Telegraph Station, which is just out of Alice Springs. So we were outside, you know, in the fresh air, in the sunshine. We had quite a well-structured event. We based the event on the Aracy areas of wellbeing, and so we did front load the attendees with a bit of information beforehand through the services. And we were able to get the summit to happen just actually because of the people who were working in the services. And yeah, that's really how it came about, is that we saw that there was a gap. We realised that there was something that we could do to get the community voice, and we worked really hard beforehand to get those people informed so that they were interested in coming down and sharing their opinions and views.
So you're saying that out of the 40, there was 40 organisations that came together, 40. And everyone's common goal there was that they didn't actually feel that the Aboriginal voice had been heard in decisions that impact.
I guess particularly in Alice Springs, you know, everybody, so many of the organisations working particularly with children and families recognise that we need to have community voice, that we can't run these programs without the people who we're working for and with, and that Aboriginal voice, especially in Alice Springs, which is such a complicated town, the Aboriginal voice was missing from a whole lot of the services, and so that's why that was our focus for the day.
So how did you even start these conversations?
One of the working groups that we've put together through Child Friendly Alice is an Aboriginal employees group. And so I, in my previous role at a child and family centre and now through Connected Beginnings, have been really able to be a part of that group and help to get a whole lot of different people who work in the service system but aren't necessarily managers on a senior level, but who do have the lived experience that we need and who do have, you know, opinions and a voice. And so what we were able to do is get that group to be the real driving force behind the summit. We got those people together and asked how they thought the best way for everyone to gather would be. So it was quite a communal effort to try and get the event planned. And it just came quite naturally once we started to frame it up. There was so many good ideas. There was so many ideas about how to get the community members involved, and it just was really natural in the end.
And what's been some of the outcomes from the summit that you've seen that you're going to build
absolutely.
on?
So it's been really helpful for people, I think, to feel connected to Child Friendly Alice. It's been helpful for people in organisations to recognise how much their work matters. The community voice, I think the community have felt much more like we were listening to what they were saying. And one of the big things that's come of it is we were able to use the voice and the data that we collected on the day to frame up a whole lot of work and feedback. And so we did present that to the National Children's Commissioner and her team. We have submitted that to the Department of Education for the engagement strategy for the next 4 years. And just having that information now and being able to say, well, this is what we've heard, this is what people have been saying for such a long time, and that the answers aren't changing, so the services are the ones that need to change. And just to be able to have that proof has been so great in our work.
So a bit like when Cosy was talking about you can't separate parts of the system, do you see that this has been a way of bringing the systems together?
Yeah, definitely can see that it's a way of bringing the systems together, and that, you know, especially living in a place like Alice Springs, we are, you know, there's people who are working, but we're living alongside each other, and children go to school together, and, you know, you're in public spaces together all the time. And so actually recognising that everything that we do, whether that's at work or in our personal lives, is so tied in together that it just makes sense to be trying to come and find some common ground.
Yeah, absolutely. I was just distracted reading some of the comments saying, fabulous work, Marley. That is the solution, having inclusive Aboriginal employer group.
Yeah, well, it's been great for us, and because we have been able to talk to the organisations who are already involved with Child Friendly Alice, and to be able to get employees who haven't necessarily had the opportunity to come and give their opinions, that I think was a real factor in making that such a successful summit for us.
Mm-hmm. And one of the things that we often hear a lot about, and it's good to reflect on in National Child Protection Week, is the voices of children and giving them real agency. How is that done in the summit? Or what are the plans for that?
Yeah, absolutely. So some of the different organisations, so the Larapinta Child and Family Centre is quite well represented in Child Friendly Alice. They obviously have connections to families and children, and they do have something called a Little People Committee. And so the questions and the answers that come from that, which include children from sort of childcare 2-year-olds to year 4 kids in the primary school that's next door, some of the questions that they came up with and some of the things that we asked of them and then got answers for, that counts as data. That is something that is really included, and that has been a really helpful step for the rest of Child Friendly Alice to do things like gather strength-based stories. We ask children what they know and love about their culture, what they do with their families, and not just Aboriginal children. We're in an absolute melting pot here. So we do recognise how important how important children's voices are, and that the children need to be engaged, and that sometimes that's the way into families, is to get the children's trust and commitment and to recognise how important their voices are.
Absolutely. It sounds like I'd like to be on that Little People's Committee and hang out with all those kids. So who runs that? Who actually runs that, and how does that actually work? Do you know anything about it?
So that's Larapinta is a suburb in Alice Springs, and there's just a really, really fantastic early learning committee there. And so that's the preschool, the Child and Family Centre, the primary school, and a daycare are all connected together and are working together to get the kids' voices there.
Oh, that sounds really fun.
Yeah.
I just getting a few. What we will do is put some of Marley's details in the email that will come out with the webinar, so that you can see how to contact Marley, or you can go onto the website of Child Friendly Alice. So I guess what I might do is bring all of the panelists back together and keep the questions coming in for everyone. I just know that we're going to run out of time, but thank you, Marley. I think that the whole concept of this webinar actually started when we had you in our other webinar, Marley, and I said that must have been really, really complicated, and you went, no, it's not really. And I guess that that's a common theme that I have heard from the panelists today, is it's actually not overly complicated if you just start with talking to community. I'm just wondering if the panelists if you can give the audience one of your biggest tips about, what should we consider when we really want to engage communities in some of this systemic change? And I might start with you, Cozzy.
Yeah, I think like Marley and Marin, you guys are amazing. And that's where I begin, like in connecting. So from my aspect, I believe people are creating an image of God, which makes them phenomenal. And I've seen horrific things. I've lived in places and been around the world and seen really horrific things. I don't want to minimize that, but that's where I try and start, and try and start with people are amazing. Like, whether it's a kid on the street, or whether it's somebody who's homeless, or whether it's a CEO of an organization, beginning with that treat them in a way that gives them dignity and humanity, to say, I just think you're amazing. And if you're amazing, I want to get to know you because you've got something that I need. And maybe it's just your story, maybe it's the simplicity of your story, your life, what you've been through, but that's where I begin. And so in networking, try and take that approach to say, look, I'm coming to the table and you guys are amazing. So I want to get to know you to figure out how we can do more amazing things together.
Yeah. Okay, Cozzy, thank you for that. It's sort of like that when you're in the supermarket and someone looks really cranky and you smile at them and they smile back. It's a good place to start, isn't it, to just engage people in a positive way. Marin, I might hand to you. What's one of the takeaways that you the audience?
I don't know, I think it's around being genuine. Like, you're not actually asking people because it ticks a box, you know, and it's a tokenistic thing. So I think if you are really genuine in asking people to be involved in whatever that might be and in hearing their voice, and that you listen really deeply to that voice, and you're not just, once I said ticking a box, that you are genuinely interested in what they have to say, then that's a really good start too.
Yeah, and I think that we can all ascertain quite quickly whether people are genuine. Children do it from a very early age, and I think it's a skill that we all have. So I think it's a really important thing to remember. Marley, over to you.
Yeah, absolutely echoing Marin and Cos. I think you both use the words dignity and genuine, and I think what I find is the most successful way to engage community is to find commonalities, and that we're really different, but we do have shared experiences as humans, and there's so many different complex challenges in people's lives, but making sure that people feel like they are being heard and understood, and making things quite place-based. I think that's the key to authentic engagement, is that to really recognise where people are coming from. And I do think that people love to have the chance to have their say, whether that be employees or the community. People want their voice to be heard. So giving people the space to do that on a whole range of different platforms is how to get the community connected.
Yeah, thanks, Marley. Now, another thing that I'll pick up, because there's so many similarities between all of the work that you were doing, but I heard you, Cosy, use the language strategic competitors versus being allies. And that's something that really resonates, working in this sector for a long time, that we often are competing for money in this space. How can we really become allies in this space? What does that look like in reality?
Yeah, so again, I don't want to diminish that people got budgets and bottom lines and things to meet. But Marley, you know, you're describing things, and there's so, like, I've always found there's so many problems. Like you can have, like, if you want people I'm working with, if you think you can do a better job, take them. Like it's
yeah.
Right. So the real problem is we just misidentify the real problem. I remember a group that was working on housing, and they weren't allowed to talk to another group working on housing. Now, we had 60,000 abandoned houses in our community. The issue wasn't the other agency. The issue was abandonment of housing. And in these cases, right, the issue is, look, if you guys want to work in the same space I'm in, please come and work in, because it's far too complex for us to do. And I think that has to begin, right? You talk a lot about reframing in a really great way, that you reframe that to saying, look, let's make sure we identify the real issue, and it's not other agencies for the most part.
I'll go around. Marin, would you like to add anything?
Can you just repeat the actual original question? Sorry, I got carried away.
How do we how can we really become allies in this space? And I think for us at NAPCAN, sometimes it's easy because we're working for prevention and everyone's quite passionate because we've done a shift from that tertiary focus. But is there any take home that you feel about how, and you do it so well, so is there any take home that you have around how we do that or how you do that?
I guess it's identifying what the common goal is. And as you say, it's not the goal of your organisation to exist and to be doing things. It's around what's our shared vision, I suppose, what's our shared activity around the families and the children. And we don't work directly with children and families, but we work with the organisations who do. So it's around, you know, what's our goal? And our goal is the safety and the well-being of children and families and communities and helping them to thrive. So if we focus on that, we are focusing on a positive way forward rather than sort of the negativity side of things.
Yeah, Marley, would you like to add anything?
Not much to add. I also think having a common goal and being able to recognise that. I think also with big organisations, sometimes it's hard to approach, you know, maybe the CEO or the board, but if you can have personal connections and you can recognise where programs could fit in together,
and then maybe it's a bit easier to go in sort of on a smaller level.
Yeah, absolutely. And I'm trying to manage the question function as well. And I think I just have to read this comment out because it says, I think you're all amazing. And I champion that as well. I think you all are. And I think offering leadership in a space like this that is modeling the ability to be true allies is not always something that we see. So I think it is a unique trait that we've been talking about. I just wonder if anyone has any other questions for any of the panel members. I'm just having a look in the chat function, but is there anything that you wanted to ask each other? No? That's okay. And I guess one of the things then that I've been hearing is that it's about how we walk alongside communities and not do to communities, but do with communities. So I just want to say thank you very much to our panelists today. You're all incredibly inspiring individuals. Thank you for taking the time out. I can't believe that we actually didn't have any, well, Marley, your internet was meant to be the best out of everyone's. You didn't even flag an internet problem.
No, so that was completely fine.
Yeah, we've even got a backup panelist presenter behind the scenes here in NAPCAN. But look, thank you so much for sharing your wisdom with us and sharing your knowledge and being part of National Child Protection Week's webinar series. So what we've heard, I guess, today and what we've heard today and the theme for National Child Protection Week is that every child in every community needs a fair go. And for us to give every child and every young person a fair go, we need to give communities the opportunity for true engagement and to be involved in initiatives and discussions that matter to them. So that's all we have time for today, but it's not the end of the conversation. And I hope that you'll be able to take something of what we've learned together forward in your work. Thank you again for taking time out of your day and joining us. Thank you.